The worsening doctor shortage in the United States has reached a breaking point, with severe consequences for patient care, public health, and the stability of the healthcare system. For decades, experts have warned that physician shortages would create widespread disparities in medical access, increase wait times, and result in poorer health outcomes. Now, these warnings have become a grim reality. Millions of Americans, particularly those in rural areas and underserved communities, are facing significant delays in receiving medical attention. The crisis is no longer a distant concern. It is actively harming patients, and without drastic intervention, the situation will continue to deteriorate. The COVID-19 pandemic exposed the fragile state of the American healthcare workforce, but the current trajectory suggests that the worst is yet to come. Even before the pandemic, the physician shortage was a well-documented problem. In 2020, 80% of U.S. counties did not have a single infectious disease specialist. Emergency rooms were already overwhelmed, and primary care physicians were stretched thin. The pandemic only exacerbated the crisis, leading to severe burnout, early retirements, and an even greater demand for specialized care. Thousands of people died not only from COVID-19, but also from preventable conditions due to delayed treatments, postponed screenings, and overburdened hospitals. These issues have not been resolved. They have only deepened. As the U.S. population continues to age, the demand for healthcare services is skyrocketing. By 2050, the number of Americans over the age of 85 will triple, further straining an already overwhelmed system. Elderly patients require more frequent medical care, often managing multiple chronic illnesses that demand specialized treatment. Yet, the country is not producing nearly enough doctors to keep up with this growing demand. The National Center for Health Workforce Analysis predicts a shortage of at least 140,000 physicians by 2036, with the most severe gaps in critical fields such as primary care, obstetrics, cardiology, and geriatrics. In rural areas, where medical care is already scarce, the situation is even worse. 56% of the projected shortfall will affect non-metro regions, leaving millions with little to no access to essential medical services. The effects of the doctor shortage extend far beyond inconvenience. In states with lower physician densities, life expectancy is significantly lower than in states with more doctors. Mississippi, for example, has an average life expectancy that is 6 years shorter than Hawaii's and 4 years below the national average. These disparities are not coincidental. Areas with fewer doctors see higher rates of chronic conditions, worse mental health outcomes, and higher mortality rates. This is a direct consequence of inadequate access to medical care. Patients who cannot secure timely appointments may delay seeking treatment until their conditions become severe or life-threatening. The consequences of these delays are often irreversible, leading to unnecessary suffering and loss of life. The roots of this crisis lie in decades of flawed policy decisions and systemic failures. The U.S. medical education system, while rigorous, has been constrained by outdated policies that limit the number of new doctors entering the workforce. The 1910 Flexner Report, which sought to improve medical education standards, resulted in the closure of nearly 60% of medical schools at the time, disproportionately affecting minority-serving institutions and rural areas. This created long-lasting medical school deserts that persist today. Later, in the 1980s, policymakers incorrectly anticipated a physician surplus and imposed federal funding restrictions on medical residencies. These restrictions have never been meaningfully reversed, creating a bottleneck in medical training that persists despite decades of mounting evidence that the U.S. is severely short on doctors. Even if the U.S. were to expand medical school enrollment today, it would take years for new graduates to enter the workforce. The problem is not just the number of medical school seats, but the lack of residency and fellowship training opportunities. Federal funding caps prevent hospitals from expanding residency programs, meaning that even qualified medical graduates struggle to secure the necessary training to become licensed physicians. This artificial limitation has created a workforce crisis that worsens every year, with no immediate solutions in sight. The doctor shortage is also being exacerbated by recent political and legal developments. The Supreme Court's 2022 decision in Dobbs v. Jackson Women's Health Organization, which overturned Roe v. Wade, has made many states with restrictive abortion laws even less attractive to medical professionals. Surveys indicate that 82% of medical students prefer to train and work in states where abortion access remains protected. This trend extends beyond obstetricians. Many young physicians, particularly those of childbearing age, are actively avoiding states with restrictive reproductive health laws. This has serious long-term implications for the physician workforce, as many of the states with the most severe doctor shortages, such as Mississippi, Oklahoma, and Idaho, are also those with the most restrictive abortion policies. If these trends continue, the healthcare disparities between different regions of the U.S. will only deepen. Addressing this crisis will require bold, systemic changes. One of the most urgent priorities is increasing the number of residency training positions. Medical school enrollments have increased modestly over the past decade, but without more residency slots, this will not translate into a larger physician workforce. Congress must act to lift the outdated caps on graduate medical education funding to allow hospitals to train more doctors. Additionally, reforms in medical education could help accelerate the training process. Alternative pathways, such as 3-year medical degrees or specialized training tracks, could allow students to enter the workforce more quickly while still maintaining high medical standards. Another critical issue is physician compensation and burnout. Many doctors, particularly those in primary care, are underpaid relative to their workload. The high cost of medical school and the burden of student loan debt discourage many from pursuing careers in fields that are desperately needed. Loan forgiveness programs and higher salaries for primary care physicians could help attract more doctors to underserved areas. Furthermore, addressing the administrative burdens that contribute to physician burnout, such as excessive paperwork and inefficient electronic medical record systems, could improve job satisfaction and reduce attrition rates. Time is running out to reverse the physician shortage. Every year that passes without meaningful reforms brings the U.S. healthcare system closer to collapse. Millions of Americans are already feeling the consequences of this crisis, whether through longer wait times, difficulty finding a doctor, or worsening health outcomes. If immediate action is not taken, the country risks a future in which basic medical care becomes a privilege rather than a fundamental right. The stakes could not be higher. Without more doctors, the health and well-being of an entire nation hang in the balance.